that, talking about, helping and supporting SLPs, which you do a lot of through your website, and just having these members and these very supportive groups that you have, I want to talk and get your opinion on, what do you see from your members and just from the SLP world, or what are the biggest challenges that SLPs are facing working in schools, not only this year, because I know there's a special set of challenges, but even last year, the year before? What are the biggest challenges that you see and that you feel like your members talk about most frequently?
Yeah. So right now, for those of you who are listening in the future, we're middle of the pandemic, question mark. I don't know if we're in the middle. Let's hope, God, we're at least in the middle. But so, yeah, so most of my members right now are in kind of almost panic mode. I mean, everybody's holding it together. We're doing okay. But nobody knows what's happening. No one knows what's coming. So some schools are virtual. Some schools are hybrid. Some schools are in person. Some schools are having their SLP in one room and the kids in a different room in the same building, but they're doing teletherapy from room to room.
Mm-hmm.
It is a hot mess across the board. And so right now I'm seeing a lot of questions on, okay, wait, how do I even do this? How do I start a Zoom call? How do I do teletherapy? How do I protect myself from germs while trying to look inside a kid's mouth? So there's a lot of those kinds of questions. But in general, we see a lot of, I've got a kid, they're doing this. What do I do? And I think the hard thing is every kid is different, right? And so every child, every situation needs to be approached differently. But when you think about these skills in terms of breaking them down into the step-by-step, that kid falls somewhere in that progression. I got a kid who can't answer where questions. Okay, well, where are they? If you say, where's your nose? Can they point to their nose? Like, if so, okay, we're beyond that. If not, try that, So a lot of times what seems really complex and scary and out of control really comes back to, okay, let's think about what we know about this skill and how to teach it. Let's think about what we know about how to do therapy. Let's think about how we normally would do therapy, and then think about how to modify that for this weird situation that you're in. So it's a lot of, oh gosh, I have this really weird specific situation, but when we really break it down, we can usually get it into a bucket,
Yeah, I love that. And the way that I think about that phenomenon is always trying to come back to the developmental trajectory of a child, right? And it's so crazy, like going back to the WH questions, like you'll have some kids who have WH question goals, and you're like, do they know how to play?
Yeah.
Like, do they know how to take turns? Do they know how to like respond to their name or what? And so sometimes when we inherit these goals, it feels really out of control because the goal almost doesn't even match the kid.
Yeah.
And so having that idea, kind of reeling it back in and thinking, how do we teach this skill? And where is the kid at on that whole trajectory, starting from the beginning of the developmental, scale.
And I see that a lot too, where people say, oh my gosh, I've got this kid and he's 6, so he should be doing these 500 skills. Like, what do I even target? And yeah, you have to think about like, okay, well, what's going to make the most impact for him functionally? Like, can he get his wants and needs met in the classroom and at home? Can he communicate with those around him functionally? Like, if not, let's start there. We don't need to be working on where questions right now. He's not there.
Yeah, exactly.
Let's back it up, So yeah, like looking at the whole picture of what's actually going to make the difference. And I think that's a big one right now for the pandemic, because what's going to make the difference when you're in quarantine at home with your child 24/7 is a lot different than what's going to make the difference in the classroom.
Absolutely. And also how things are presenting themselves, right? Like how kids are presenting behaviorally and engagement wise. Like interacting 2D with a screen is a completely different skill set than a kid interacting with like a 3D classroom world.
Yes.
And so even that is like a huge difference, especially for more highly impacted kids. It's like we're talking about two different, realities that we're living in.